If your back has been hurting for days and ibuprofen isn't cutting it, you know the feeling. There's a tree growing near rivers and lakes that has been used for pain relief for over 4,000 years. Not a prescription, not a new drug, just white willow, the tree that gave us aspirin. I tracked my lower back pain for 4 weeks. Same routine, same desk job. Then I started researching this ancient remedy instead of reaching for another pill. Used since Hippocrates' time, 400 BC, where people chewed willow bark to lower fever and inflammation. Now, a 2025 randomized controlled trial published in the Journal of International Oral Health found that 600 milligrams of willow bark extract actually outperformed the standard NSAID diclofenac for pain relief. 90% of patients in the high-dose group achieved clinically significant pain reduction. The active compound is salicin. Your body metabolizes it into salicylic acid, the same active ingredient in aspirin. A 2023 meta-analysis of randomized controlled trials confirmed that willow bark provides significant pain relief for arthritis patients compared to placebo. Multiple studies also support its use for lower back pain and menstrual cramps. Here's how it works. Willow bark extracts inhibit COX-2 enzymes, the same pathway that NSAIDs target. But unlike pure aspirin, willow bark contains over 40 additional compounds, including flavonoids and polyphenol, that may work together synergistically. So why isn't every doctor recommending willow bark? Why do we still reach for synthetic pills first? Stay with me. Here's the truth. The research is promising, but still limited. Most studies are small or short-term. The 600 milligram dose works, but that's higher than most over-the-counter supplements. And consistent dosing can be tricky because the active compound varies depending on when and where the bark was harvested. Neither does science. Yet. I called a friend who's a pharmacist. She laughed. She said, "You know aspirin originally came from willow bark, right?" I didn't. I'd been taking synthetic pills for years. The tree outside my window had been nature's pharmacy for millennia. I spent $50 on a bottle of willow bark extract, a fraction of what I'd spent on over-the-counter pain relievers. Here's the thing. Willow bark is not for everyone. Do not give it to children under 18. It's linked to Reye syndrome, just like aspirin. Avoid if you're pregnant or breastfeeding. If you're on blood thinners, check with your doctor first because it can increase bleeding risk. And anyone with a salicylate allergy or stomach ulcers should stay away. If you want to try it, look for standardized extracts containing 120 to 240 milligrams of salicin daily. Start with a lower dose. Take with food. And talk to your doctor, especially if you're on other medications. Not medical advice. And that's just the bark, the leaves and catkins, different compounds, different benefits. I'll explain next week. Not medical advice. Consult your doctor before use. Do not give to children or take if you're on blood thinners. The tree knew, long before the pill.